All right. It looks like we actually have maxed out this room, which um, I wasn't sure if we would, but however, I knew we would get a real good turnout for this meeting. Clearly, this is on everyone's mind and something that everybody really wants to know what we're doing as a school. So to make accommodations, what we will do is we're going to move forward with a presentation. And then since we are maxed out at 300 participants on this, what we will do is we will make the presentation available. It'll be definitely available tomorrow morning. And then tomorrow evening, I will have another Q&A. So at the end of my presentation tonight, I can answer some questions from people. We can use the chat feature and Mr. Nofi will identify them. What basically happens with Zoom is if your video goes on, you end up going to the front page. So if you have a question, I would suggest if you turn your video on, you'll come right up to the front page. Otherwise, please leave your video off. That'll enable us to recognize that you have a question. And you could just ask that question in the chat. So what I'd like to do then is I'd like to get started. And as we do all the time, I would like to begin with the Pledge of Allegiance. So I'll start. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, I have a presentation that is done in a Google Slides. However, we will convert that to a PDF, and that will also be posted for your reference on our website. So I'm going to share that now. And so I would start by saying, it's been several weeks since I've last posted to the community. But I want to say that this has really, obviously, truly been a challenging time, and I want to thank our community. Last spring, we saw our community come together in ways that were just truly inspiring, and it's what we needed to get through this pandemic. I do hope that our Santa Merchis families are enjoying this wonderful weather, getting some good beach and family time. Because that's what summer's all about on the east end of Long Island. We have, to begin, we've been working on this reopening plan, I'm going to say since March 3rd. And the reason I say that is because that's the day when I think I attended the New York State Department of Health presentation and came to the realization that a school closing was a potential reality. A few weeks later, on the 16th of March, we actually closed our doors to physical school. And it was surreal to me somewhere in May when I was walking through the halls and noticed that our school seemed to be frozen in time. As you walk through Clayton Huey Elementary School, you saw just about completed projects for St. Patrick's Day that had not yet gone home, but were ready to go home. And that was in May. So it was a surreal feeling. And it really was overwhelming for me to think that this is what we were going to be doing for the rest of the school year. Well, here we are getting prepared to open up for the 2020-2021 school year. And we still have lots of uncertainty. One thing's for sure, we are going to put together a plan for educating and supporting all of the kids in our school district in the best possible way we can. And that's our commitment. So we began by putting together multiple committees. As you know, we surveyed our parents, we surveyed our students to find out how we were doing with our distance learning in the spring. We wanted to get some feedback on that. We got great feedback on what parents thought was working, what kids thought was working, and what we needed to do some things better in. So a lot of that feedback helped us. We started to put together committees. As many people know, I'm very active at the county level, and we mirrored a committee that we put together in Suffolk County of superintendents. And we had multiple committees, including building procedures, building use, which covered sports and transportation and things like that, cleaning and sanitization, health and wellness, and as well as our instructional program. And we had lots of people, lots of community members, parents, administrators, teachers, paraprofessionals, all staff members, clerical, everybody that wanted to participate was permitted to participate. On here, you see a list. We had board members on there. You could see a list of people, and I'm certain that in some way there were other people that participated. So if I've forgotten you, please forgive me. But we did have upwards of 70 people participating in our reopening task force. So I want to thank those people because the surveys that we put out, coupled with the support of all the people that put their heads together to really focus in on all of these different areas that we needed to examine, made it very important. I would say that what a lot of people came, when you were in the cleaning and sanitization group, you came with a mindset for how do we best incorporate the CDC guidelines and DOH guidelines for cleaning and sanitization in our buildings. When you came from the instructional, you said, what is the best possible plan to educate kids if we have to do it in a hybrid, in an in-person model, or in a distance learning model? So lots of different lenses came from lots of different people from different groups. And I must say that makes it difficult because in the end, you need to put a plan in place that incorporates the ideas from all the different groups and really synthesizes lots of information and data. The other thing we did was we had the staff, and parent surveys about reopening itself and about what your concerns were, what things you'd like to see, what we could do to improve, so there was one about our distance learning, then there was one about reopening. And that was helpful for us also. So with all of that data, multiple surveys, staff, community, parents, students, and all of the people that participated in these committees, we were able to try to put together a plan once the guidance came out. Keeping in mind that guidance came out from New York State Ed, and we had exactly 2 weeks to put together a plan. So this plan is expected to be submitted on Friday, and we're going to be doing that. Another thing I would say is that the reopening planning does require certain personnel designations. Mr. Soto, our assistant superintendent, is in charge of pupil personnel services and oversees our nurses. He will be our COVID-19 administrator, and our building principals, in conjunction with our nurses, will be the building designees. I have to say that in terms of our plan, I want to just say that when we focus on the plan, and I've had multiple conversations with board members and teachers and community members that are very, very passionate about their ideas. When there is a disconnect between instructional pedagogy or cleaning, anything, the thing that has to always win out in my mind as superintendent so that I can sleep at night is the health and safety of kids and staff members. And so when things were at odds, we are erring on the side of health and safety. I would say that it's very easy to sit back and listen to what another district might be doing in another community, whether that be a larger district, a smaller district, or a district similar to us by outward appearance. I think it's important to note that Santa Mauritius is unique. Santa Mauritius is staffed differently than other districts. Santa Mauritius has different class size ratios. Santa Mauritius has different class configurations and square footage in the classes than other districts. So when we make decisions and when we make recommendations, I must make those recommendations based on what we know we can do and what the capacity for us in terms of being able to initiate the kind of cleaning protocols we have to, and the social distancing, use of PPE, all of those kinds of factors have to be taken into account in creating a plan. So what we've established, what we believe we'd like to establish, is a phased and very flexible reopening plan. That's done by design because we want to be able to not just jump in feet first and say, we're bringing back 1,500 kids on the second day of September, and we're going to throw caution to the wind and see what happens. We need to test our systems. We need to test our transportation systems. We need to test our cleaning and sanitization systems. And so we need to do it in a phased mentality. And we will have some look back periods to make sure that we are doing it in a way that clearly is in the best interest of the health and safety of kids, placing that first. So it is a document that is meant to be modified. Even at New York State, when we submit this document, we are submitting a link to our website because the document is meant to be one that changes based on circumstances on the ground. So what could change? Well, lots of things could change. We certainly don't want to be in a position where people are looking at us and they're looking at us like Major League Baseball, right? Major League Baseball came out and within 72 hours, there was a case where 14 players on one particular team came down with COVID-19. We don't want to put ourselves in that circumstance where we're vulnerable and we didn't put situations in place to account for any possible scenario. So we want to be very cautious. We want to do everything we can to support the education of kids, but we want to be cautious about it as well. So as I said, this is what I would ask is if there are hands raised and things like that, if you'd let me go through the entire presentation. And then at the end, we will certainly have a question and answer period. So if you hold till the end, we'll make sure that we address everyone. In this format, it is difficult for me to recognize when people have their hands raised. So I do have Mr. Nofi to help me with that. And we'll do so with a question and answer period at the end of the presentation. So as I said, it will be a living document. It's meant to be modified. Part of the guidance from New York State Ed says that we need to monitor the metrics and the infection rates in our communities. And if the local Department of Health, Suffolk County, reports changes, we certainly would have to make modifications. The ability to implement this plan as per the guidance coming from various entities like New York State Education Department, the Department of Health, the Center for Disease Control, all of those, and those changing recommendations that come from them. As I said, we will reevaluate the efficacy of this implementation. One thing that I will always emphasize is that health and safety is the highest priority. Our ability to implement protocols and procedures effectively, and certainly the instructional effectiveness. We want to make sure that we are teaching to the next generation learning standards and children are getting a full year's curriculum. So we have posted initial review dates of 9/21 and 10/13. Those are dates where we will be looking back and adjusting, taking a look at all of our procedures, making sure that we have done everything we can to ensure the health and safety, and then making adjustments to say, can we increase capacity? Can we change certain protocols? Must we change certain protocols? But please understand that our ultimate goal is 100% in-person instruction with the greatest emphasis on health and safety. And when we get to that, will be a matter of how effective we can be in doing all the things we need to do. So, as you know, it's very clear, our governor has made it very clear, the only person who's making a decision on whether or not schools open is Andrew Cuomo. He has stated, right now the plans are due on Friday, as I stated. However, during the week of August 3rd through 7th, so next week, Andrew Cuomo will tell us if schools should prepare to open. And that is only if we are in phase 4 and the daily infection rate remains below 5% or lower using a 14-day average. Right now, we believe we're on target for that. He has indicated that schools will close if the 7-day average is greater than 9%. So that's what we're looking at. And we do believe that next week he's going to be telling us that we can start to prepare for in-person, some sort of in-person instructional models. When we began we put together a lot of information. There are lots of medical expertise out there. The American Academy of Pediatrics and the Center for Disease Control certainly lead the way in providing recommendations. Here you see certain recommendations for elementary and secondary. And it's interesting to note, though, that some of these recommendations, certainly, when you talk about utilizing outdoor instructional spaces, opening windows and doors and things like that, some of these are contrary to the typical safety recommendations that we have from fire marshal or police and law enforcement. So some recommendations are at odds, but we will certainly take all of that into account and do everything we can to ensure the health and safety of kids. Certainly the recommendations are for face coverings. For younger children, certainly what we've heard is that any below 2 years old, they should not wear them. Fortunately, our children are 5 and older, and face coverings are permitted on them. I have to say that all of these things that we're going to be doing are going to rely on the extraordinary partnerships we've had. And that's with parents, with teachers, with administration, because in order to make this work, everyone's going to have to work together. Our students are going to have to understand the expectations, and they're going to have to adhere to them, just like we all will. Keeping desks 6 feet apart as per the CDC recommendations, students not being able to share objects, all of these things are important ideas. One of the biggest ideas is that student classes are considered cohorts. So an individual elementary, clearly that makes sense because they generally always stay together. In the secondary, that is also the recommendation, to use a cohort model to whatever extent possible limit the crossover of students and teachers. We are going to be eliminating the use of lockers, and these all are recommendations for the elementary and secondary. Moving on, some of the recommendations for busing. One of the recommendations, and again, when I talk about partnerships with parents, we have been in the guidance. It asks us to encourage parents to use alternate means of transportation. So, in other words, can you, as parents, drive your children to school, or get your children to ride to school, or walk to school? Because those are the kinds of things that enable us to manage this a bit better, because we are going to be very limited with what we can provide for transportation, or we will need to increase our transportation routes. One of the things that they also mentioned is, the remote screening, having parents screen their kids. In other words, taking temperatures every morning. And so you'll see in the plan, when I get to the actual plan, that is something we'll be talking about. Seats will be split apart. However, siblings are encouraged to sit together. Things will be, the way we load and disembark our buses will be important. Making sure the face coverings are worn on buses will be important. Looking at our hallways, you can't go to a supermarket these days without seeing one-way aisles in supermarkets. That's what we can expect, in our schools. We will be providing lots of visual guides and signs and things like that. In addition, the meals, we need to consider how we are delivering meals, and there are certain recommendations from our medical experts on that as well. So then, once we look at the medical, we also get, from those two, we get specific guidance that came out, and that's the guidance that we needed to build a plan off of. And that guidance came from New York State Education Department in conjunction with the New York State Department of Health. And as you see here, many of those things, and as I go through the plan, you will see that all of these things will be included in our plan. So from health and safety, from having to teach about hand and respiratory hygiene, the daily health checks, the way we have to isolate symptomatic individuals, all of these things are going to be in our plan, as you see. The idea of social distancing PPE as well. Our cleaning protocols clearly have to follow certain procedures and guidance, taking a look at our ventilation system, looking at large group instructional spaces and changing the way in which, in some cases, instruction is delivered. And it's important to note that the fire and safety drills, lockdown drills and all, are actually mandatory still. However, we have much flexibility in the way we can administer those so that we can maintain safety. Furthermore, as I indicated earlier, we must continue our food service, and we must be able to provide the free and reduced food services to people who need those. Transportation there's lots of guidance on the way that needs to be cleaned, the way that needs to be organized, as well as PPE and mask requirements. Certainly, anyone that knows me knows how passionate I am about the social and emotional well-being of kids, and we really need to take that into account and provide supports for students and for staff, because we know about the stressors that come from this pandemic and the distance or hybrid learning model can contribute and exacerbate some of those difficult emotional circumstances. School schedules, we do need to create a model for in-person, hybrid, and distance learning. The feeling is that we should be able to go seamlessly from the 3 different models, and we have put together a plan that enables us to do that. And then, obviously, every single thing that we're doing here requires money. We will be purchasing individual desk barriers for every child, and that's going to be a substantial budget item. When we were going through the budget process, one of the things that I always emphasized in our budget presentations is that we will need unprecedented flexibility in spending, due to the fact that we were budgeting in a traditional manner, but really unsure what it would look like moving forward for this year in terms of what school would look like. Then again, guidance and connectivity. Certainly, in terms of the technology and connectivity, we really need to provide adequate access for everybody. So for homes that do not have adequate access, we will be working with those parents and families to make sure that all students have the same access. We do need to provide communication in the preferred language of all families. So that is an important thing. And we need to maintain all the protocols and supports for English language learners. For special education, same thing. They are a high priority in terms of providing the kinds of support that our students with special needs have. And we are committed to doing the best we can in that regard as well. But all IEP mandated services need to be delivered. And then for those that are interested in particular in athletics, the fall season has been delayed till September 21st. Again, that is one of our look back periods. All fall, regional, and state championships are postponed and canceled. If in fact Section 11 and New York State Public High School Athletic Association are unable to run the fall sports, they are proposing a 3-season sports schedule that would have a winter, would be January 1st to March 13th. Season 2, those fall sports that would be postponed would be moved from March 1st to May 8th. And then a third spring season that would be April to June. So that's part of the plan that New York State Public High School Athletic Association is planning. So, I'm going to get into our plan now and understand that communication and family engagement is obviously critical, that regular and frequent communication is essential. As you know, I tried to do those every Friday. I did those videos to try to keep people informed, and I will continue to do that. I believe our stakeholders and community members need to be connected. This plan was developed with administration, faculty, staff, students, parents, and legal guardians, local health department, our healthcare providers, and all affiliated organizations. So lots of people had a say in this plan, and I think it's important that all voices are heard in that. In terms of communicating it, we will be using every possible medium. We'll be using our district webpage, video messaging, our phone messaging system. We'll be using email, all of those kinds of things. And we also will be doing all the instructional things that we'll be putting out there, training and communication. We'll utilize all of those mediums. Throughout our school, we're going to have lots of signs posted, and most of those, lots of those are going to have the Center for Disease Control and Department of Health guidance with regard to PPE, personal protective equipment, face coverings, hand and respiratory hygiene, all the kinds of things that we need to be teaching and we need to be focused on. There will also be regular PSA announcements in classes and over our PA system. So it will be pretty comprehensive, and we will provide those in the languages of families. Written plans will be available, and those will be posted on our website as soon as they're put up on Friday. And then once again, I can't emphasize enough that this is going to be continuous reflection. We will not simply be putting out a plan and saying, this is what we're doing from September to June. The plan is a plan that is going to take into account the feedback we're getting from parents, the feedback we're getting from teachers, the feedback we're getting from administration, because we want to make sure that we are doing this as well as we can and as effective as we can. So in terms of health and safety, based upon 6-foot social distancing and universal masking, which is what our recommendation will be. You can see the picture here from an IB school in Korea, and that's similar to what, absent the uniforms, we will be at about 50% capacity, and we will be at 6 feet with universal masking. We will need to relocate any classes that exceed spacing requirements. We're going to have to relocate. We have an actual calculator that calculates how many bodies can be in a particular room. So we know that, for instance, minimum square footage is 540 square feet for 15 people. We have every intention of utilizing and repurposing some of our large spaces. So our gyms, our offices, cafeteria, LGIs, all of those kinds of things are open, and we are looking at how can we utilize those differently so that we can maximize our instructional spaces and spread kids out. There is, in order to go 50% capacity, that means that we're utilizing an A day, B day model so that we can have full days instruction for the students on the days they're in. Self-contained special ed classes, our 811 classes, will be at 100% capacity 4 days a week. So they will be in more, as I indicated earlier. Our DCT, ICT classes will follow general education capacity guidelines. Again, I said we were purchasing barriers, so we are seeking to purchase barriers for all student desks. And at present, to start the school year, there will not be any extracurricular or clubs. And again, we will reevaluate. First week in August, the governor is going to be making his announcement, and we'll begin to reevaluate. As soon as this plan goes up, that's when we start to reevaluate based on conditions. In terms of health checks, one of the large requirements in the guidance is that we do need to do health checks. All staff needs to answer a mandatory 4-question survey, including a temperature check on a daily basis. So that is something that gets sent out every morning prior to going to work. I click on a link, I answer my questions, and as long as they're all no, I go to work and I don't have to do anything more. But they are recorded. It is confidential health information. It's not kept anywhere other than their yes and no questions, and information is not recorded. Confidential health information is not recorded. We do need to do student health screening and temperature checks. So this is the part where we're going to need a real strong partnership with parents. In order to ensure this compliance with the New York State Department of Health recommendations and requirements in the plan, they recommend that we do remote checks. So for instance, we cannot allow students into the building if they do have a fever above 100.0. Therefore, we will ask that daily temperature checks take place at home by all families. any family who does not have a thermometer, we will provide. So there will be some surveys coming out. Once this plan goes live, we will be asking lots of questions. Questions about what your plan is for ridership to and from school, whether you're driving your child, whether you're going to be relying on bus transportation, whether or not you can have the wherewithal to be able to take your child's temperature, whether or not you intend to even send your child to school, because some parents may decide that they do not want to send their children to physical school and would have a distance learning option, which will be an option. However, one of the things that we'll be doing is we will have bus matrons on, and we ask that all parents in grades K to 8 walk their child to the bus, escort their child there, and it's a simple question. Did you take your child's temperature? Was it below 100.0? If it's a yes, the bus matron can just mark off pass and then allow the child onto the bus. If they do not, and the parent is not there and they cannot affirm that the temperature was taken and it was below 100, we will need to take the temperature prior to boarding the bus. And again, that is part of the recommendations and guidance that we have. Upon arrival at the school, we will have our seniors who drive and our staff pulling into the back of the school. All others will be coming to the front of the school, multiple arrival locations, and we will have staff there doing the same kind of thing, checking to ask to see if the temperature was taken and to confirm that it was below 100. If that's the case, the student will be permitted in the school. If not, we'll have to take the temperature upon arrival and before the student enters the school. So we will be doing that on a daily basis. And again, that is part of the guidance, and it's what we must do. There's really no negotiation on this in terms of what the state is telling us we must do. And then every Wednesday, we are also beholden to periodic health screenings. So every Wednesday, we will be sending out a link to everyone's smartphone that they give us a number to, or an email. And then what you can do is you can click on it, go to the Google form, and do the same thing our staff does. Answer the 4 questions. And if it's no to all 4 questions, then that's the periodic health screening that says your child is healthy. If not, then we certainly would want to follow up with the parents. So that's the health and safety and the health checks and temperature screenings. In terms of training, we must, according to the guidance and everything that New York State is expecting of us as a school, we must train all staff on these things, on the use of PPE, personal protective equipment, on social distancing, and how to observe for signs of illness, as well as COVID-19 protocols for students and staff who may feel ill during the school day, or what happens if somebody has a positive case. On the first day of school, all students will also be trained, and we must train them periodically through proper hand hygiene. And we have, as per the New York State Department of Health guidance, scheduled hand washing times throughout the day, and it is very prescribed on when those times are. Proper face coverings, and we will have scheduled mask breaks for children. One of the partnership ideas that we're going to have with parents is this idea of mask endurance. That if kids are going to be asked to wear their masks in school, they are going to have some familiarity with wearing a mask. And some kids will really need to build up their mask endurance. So we will be forwarding information about how to go about doing that so that the children can be comfortable when they come to school. Certainly social distancing is going to be important and something that we're going to have to train everyone on and teach them about what that looks like, and when it needs to be incorporated, which is essentially all the time. And as I said earlier, respiratory hygiene as well. Oops. Let's skip one. Okay. Health and safety. Continuing, again, this is the biggest thing we can talk about here. We are going with the universal face coverings with scheduled mask breaks. We will be providing masks for anyone who needs one, as per the New York State Ed guidance. Essentially, it says that we have a schedule for what we need to provide for our staff members. And in addition, children are encouraged to bring their own masks that are appropriate. But if they don't have one or forget one, we certainly will have them on hand. Our health offices and custodial will be supplied with N95 masks, face shields, and gloves as per the specified protocols that must be in place. We have antibacterial dispensers in all classrooms and hallways, and signage throughout the buildings all throughout. So, what happens when somebody is exhibiting signs of illness? First off, again, through the partnership, anyone that is feeling ill these days must and should always stay home. So any fever, any symptoms, any symptomatic students really should not come to school. If kids do come to school and they're exhibiting any signs of illness, they'd be sent to the nurse's office. If those symptoms are consistent with COVID-19, which the 10 symptoms that are prevalent with COVID-19, they would be considered a person under investigation, a PUI. And those people in that instance, we are directed by our state Department of Health to isolate that student until a parent and guardian can come pick them up. So isolation means that we have to have a separate location outside of the regular nurse's office that we can place children. And if there are multiple children that have COVID-19 type symptoms, we can place them in there, but they need to be socially distanced and have masks on. But we do need to isolate them from kids who are routinely coming for medicine or anything like that. So it is important to note that there are space requirements that we are beholden to. And then we would recommend that they contact their healthcare provider, and staff with symptoms get sent home immediately. Our local Department of Health, I have been on the phone with them several times over the last week, and I was on the phone with them this afternoon, and they are partnering with us to create really well-established protocols that would suggest exactly what we need to do under different circumstances. So if a student is symptomatic and there is a positive case in a staff member or student, obviously we would communicate that to all our stakeholders, and we cooperate with the Department of Health for contact tracing. We are mandated to work with our DOH and provide them with any names of people who were the look back period is 48 hours from the time. We would have to go back 48 hours and look at all our visitors logs, look at our bus ridership, look at our classroom rosters and our seating charts, and be able to provide information for who may have been in close contact with the child. The Department of Health's job is to investigate that and contact all of the families and then lead the investigation. The Department of Health will decide who would need to quarantine. So basically, if there is a classroom and there is a student that comes down with a positive test, the likelihood is that the students that were in that class likely would have to be quarantined for the 14 days. And we would have to move to initiate our protocols for a positive test. We follow all the CDC and DOH guidelines. All the impacted locations, the building, the bus, and all of those things are cleaned according to and sanitized according to CDC guidelines. And quarantined students and staff members would shift to a full distance learning model. So that's that pivot right there to full distance learning. Students and staff can return to school with the following. This actually is really supposed to be 72 hours fever-free and cleared by the doctor without any symptoms or medication. Or what we're really going to be getting, and I got confirmation from this today, is the Department of Health will be issuing a letter of clearance for staff members or for kids to allow them to return to school. As you can imagine, we will not be allowing visitors to our school. So visitors will be strictly prohibited. We really need to limit the flow of people in, and that will help us with in terms of maintaining a healthy and safe learning environment. Emergencies only, and on occasion approved vendors that have administrative approval. Those vendors would have to go through the same mandatory health screening and temperature checks, and they would sign in and document for any contact tracing purposes. Parents or guardians picking up children, they would be waiting outside, and we would be escorting the children out of the building to the parents and guardians. In terms of our facilities, again, really cleaning, following the guidelines for the Center for Disease Control. We will have cleaning supplies available in all classrooms for intermittent cleaning, wipe down of desks, wipe down of commonly touched areas. And then Wednesdays will be what we refer to as our deep cleaning day, a real deep sanitization of the entire facility. We will be disconnecting our bathroom hand dryers and our water fountains. We cannot, hand dryers are said to aerosolize the infections, so we really can't have those running. All unit ventilators and HVAC filters have been upgraded and replaced over the summer and will continue to be monitored. I talked about the safety drills earlier and making sure that we are socially distanced and staggered so that we can do it safely. In terms of child nutrition, I indicated earlier that we do have to provide those meals. Meals will be available to all students Monday through Friday as grab and go. And then parents and students will be encouraged to pre-order their meals so that we can avoid handling cash using our prepay system. In terms of lunch periods, at Clayton Huey, they will be eating in the classroom, and the meals will be delivered to the class. At the high school, middle school, students would be eating in the cafeteria and gymnasium, and we will be staggering those so that they're not on back-to-back periods. You can see on here, when I say universal masking, you can see even our buses are masked. But temperature checks will be verified prior to boarding, as I said. We have modified bus routes to accommodate social distancing and an AB schedule. Mandatory face coverings, and same household will sit together. Buses loaded back to front, disembarking front to back. Again, all of this to try to maintain a completely clean and sanitized environment. Our buses also will be sanitized after each route is completed. Drivers wearing masks, shields, gloves. They will have their periodic training just as our staff does, and they are beholden to the same health screenings that our staff is. In terms of social and emotional well-being, we will be ensuring that all the mental health resources available for staff and students that we have when school is in full session are available. Our guidance counselors, mental health staff will be providing the same kinds of supports based on need in a 3-tier system. So at the very base level, and then moving through much more intense levels as the need arises. We will be doing some mental health screenings and check-ins periodically. There are lots of parent resources on our mental health page on the district website. Our staff did a great job of using some targeted support groups. We will continue to create support groups so that students can wherever the need might be able to speak with a counselor appropriately. Sessions will be offered in person and remote based on the need and based on the accessibility. Obviously, for mental and social and emotional well-being, scheduled mask breaks are important. And we will be focusing on this idea of equity, making sure that no matter what, all have the same access to the learning. And that's a critical component of this plan. Getting to the teaching and learning part, our primary objectives are what's listed here, that we need to assess all students to evaluate their readiness. Was there some regression? Where are they at? What is their baseline in whatever class they're taking, whether it's 3rd grade, whether it's pre-calc, whether it's physics, AP physics. We need to understand the readiness level of kids, and then we need to meet them where they are, and we need to deliver a full, rich curriculum aligned to the next generation learning standards. There needs to be daily access to instruction for all students with regular substantive interaction with teachers each day. And that's important. Our teachers know that that's the only way that they're going to connect, and they're going to be able to teach the kids, and they're going to be able to support them from a social, emotional, academic perspective. So all supports need to be in place to meet the academic, social, and emotional needs of every student. Again, I talk about this, this fluid transition from hybrid to in-person to distance learning. We really need to be adept and nimble to be able to jump back and forth to the different types of learning environments. So what does this schedule look like? So a proposed school schedule would look like this. We would have, and again, I want to talk about this because this is an essential part. This is a part where some some board members, some teachers said, Ron, this does not make sense. This is not educationally sound. And I said, well, I'll tell you what, this is not my preferred model for an educational standpoint, but this is the best model to ensure that we maintain a safe and healthy environment. Essentially, with a 48-hour look back period and a mandatory 24-hour freeze on cleaning areas prior to cleaning, this is the best way to ensure that there is no cross-contamination amongst cohorts. So if a group of students comes in on an A day, and we break that down A to L and M to Z by household, we would be able to have those students in on Monday and Tuesday. There would be a distance learning day on Wednesday, which would be deep cleaning. And then that would eliminate the possibility of any kind of cross-contamination on a Thursday and Friday to the B cohort. We could then clean on Saturday and Sunday and have a completely clean environment for the cohort A. And again, this is one of those things where if the students are not in there and given the way the infection spreads, we are able to keep the cohorts as separate as possible for their safety. If a student on a Monday, we find out that they have tested positive or a teacher has tested positive, that does not have to impact our B cohort, and they don't have to miss a day. So when cohort A is in live session, cohort B is in distance learning and vice versa. Wednesday, all students will be on distance learning. Important to note that attendance is taken on a daily basis for every student. Whether a student has chosen 100% distance learning or they are in the A cohort or the B cohort, attendance is taken on a daily basis. When on CHAMP will be open, but only if your cohort is in session. When on distance learning, alternate care would be required. And then students not comfortable coming to school could be on distance learning 100%, as I stated earlier. Teaching and learning in terms of the distance learning, just as we did before, Chromebooks will be available to any student that needs access. We will again provide resources to make sure that every student has Wi-Fi access in their homes. We will be reaching out and trying to make sure that there is 100% access. One of the things that was really important, and in particular at the secondary, is making sure that we can maintain the master schedule. We wanted to have the master schedule so that it remains, and that if we begin on this hybrid model, but at some point we're able to go back to 100% in person, we can just switch right back and go into our regular schedule. And what we've done here will allow us to do that. It will also allow us to keep the traditional schedule if we go 100% distance learning. So I think that's an important part of this. There will be lots of resources to support families. The spring was a good experiment for us. I think we learned a lot, and we have great ideas for how we are going to be able to provide that substantive interaction with all students each day. In terms of special education, all 811 students will be in attendance for the 4 days a week. The CSE, CPSC, and 504 meetings, those will be via Zoom, as will all parent-teacher conferences and other meetings. And in terms of our instructional supports, they'll be implemented in person, and they will be implemented virtually as well for IEP and 504. English language learners will follow an AB cohort schedule, but they will be their ENL teacher will be supporting their modifications in person as well as virtually on those off days. Okay, in summary, I just want to go back to where I started and say that this really is a living document, and it will evolve based on the local metrics. We will be in constant consultation with the Suffolk County Department of Health, the CDC, and following the guidance of the CDC and the Department of Health. Looking at any positive cases reported that impact our operations, that's how we will be monitoring and making adjustments. We have those planned look-back periods to assess our capabilities and adjust our plan. It's our intention right from the start to ensure that we make every effort to move toward a full implementation. We don't know how long that will take, but that will ultimately be what we'll be working toward. Again, the primary focus is the health and safety of students and staff. Our hybrid learning model will maintain social distancing and universal masking. If we have to close, there will be a seamless transition to distance learning. And then finally, there will be lots of different required, additional staff, certainly managing the health screenings and social distancing in the hallways. All of these kinds of things we are putting in protocols and procedures for at our arrival and our dismissal. So we will be counting on parents and we will be counting on students to be partners with us so that we can make this as seamless as possible and be as effective as possible. Folks, this is not what I ever envisioned when I came to Santa Mauritius about 13 months ago as your superintendent. But I can assure you, we are doing everything we can to ensure that we are providing, the best possible learning environment that is safe, healthy, and as effective as possible for your kids. I'm going to stop my screen share now, and we're going to go over to the group here. It looks like we still have about 300 people in here, so thanks for sticking with me all through. But I'm going to turn it over to Mr. Nofi, and he is going to be able to pull people up that have questions, and I will do my best to answer them. And if I cannot answer it right on the spot, we certainly will do whatever research we have to make sure that we can provide answers to your questions. So, Mr. Nofi, if you see anybody that has a question, I'd be happy to try to answer that.
Okay, let's see. We have one, Crystal Primus.
Yeah, hi. You mentioned that.
Any hands raised?
Yes, my hand's raised. Any student that's in a self-contained classroom would go 4 days a week, but you only mentioned the 811. You also have a self-contained 1211. So what about them? Hello?
Crystal, I can hear you. I don't know. Ron, can you hear Crystal?
Hello?
Hello, can you hear me? Hello? Hello?
Hello? Hello?
We can hear you.
Yes, my question was, you talked about self-contained classrooms going 4 days a week in person, but you specifically mentioned the 811. You also have a self-contained 1211. What about them?
Okay, you know what? I wasn't hearing the whole question. I think I heard the tail end of that. Yes, we do have self-contained in the 1211 and the 1511. The part of the problem with the other classes is that some of those classes have to be mixed with the other cohorts of kids. So we're not saying we won't. We're saying we're trying to figure out how to do that with those classes, which is problematic if we are going to mix cohorts. So we're trying our best to figure that out. That's something that we don't have a definitive answer to at this time.
Okay, Tom Stokes. Tom, are you there?
Tom, he's
Yeah,
muted.
I'm sorry. It looked like I was automatically muted. First,
Okay.
I just want to say, Ron, it's great to see you. And first and foremost, want to thank you for hosting this session, providing a very thorough plan, and for all the work that has been done and the work that's to come. As you know, as you can imagine, I've got a series of questions. I don't want to take up everyone's time, and perhaps it's best handled sort of offline. And I'll throw out a few key things, and just for background for others who are on the line. I'm currently an executive at a major medical institution in Manhattan who has seen more COVID patients than probably anyone in the country at this point, and have been thinking about COVID and working through COVID since January. So I'm glad to hear things about the cohort model. Things like the PPE reinforcement, I have to tell you, that's going to require a lot of discipline. I mean, I have grown adults who are employees who get paid, to do this and don't wear their PPE appropriately.
Sure.
So we have challenges there. I'll also say the issue of temperature screening. We have our employees doing something very similar to what you just mentioned. I would suggest that we think about, though, the bus matrons or perhaps someone else in a similar capacity, hand them a $50 temporal scanner instead of asking the question. Because frankly, you're going to get the question answered in the manner in which the individual wants to provide it. So, providing factual data around, what's going on there certainly will help. I'd also say, a couple of ideas that have been raised in terms of, the whole cohorting model. Again, this kind of goes to the same issue, but I'd be curious to hear a little bit more about what, especially for the high school students and even the middle school, I guess, what changing of classes looks like in this new environment. Is it the teachers changing classes, or is it the students changing classes, and how does that occur, with allowing for social distancing? So I've got a myriad of things, Ron, that I can sort of bounce you a note on, just
Sure.
general thoughts. Again, don't want to put you on the spot, having to answer all these questions. Clearly, I've been thinking about this for a long time, and so have you, but certainly since January in a much more intimate environment.
Yeah, and Tom, I thank you for that, because, and this is part of the idea of a phased reopening, and not trying to jump right in and really sticking with a 50% capacity to begin, because, some of those things, having to consider switching of classes and cleaning the desks in between classes with 3 minutes of passing time, those are complicated thoughts. And when you've got a full 600 kids in a building, that's one thing. But, limiting it to 50% capacity is a help in that, so that we can test our systems and our procedures before we try to move forward with an increased capacity. So, that's one of the reasons we really want to, do this slowly, do this very cautiously, to make sure we're emphasizing the health and safety. But any ideas that people have for supporting that would be, really very much welcome. So thank you, Tom.
Yeah, I'll just say, Ron, just one last comment that, when we were considering reopening to see our patients, right, which typically would be somewhere in the range of about 7,500 per day, coming from multiple facilities, we were so concerned about the social distancing issue. And frankly, it's a little bit different. We're not, you can argue kids versus adults, and Manhattan with elevators and all sorts of stuff, all different complexities. But we actually started at 25%. And these are the physicians who were dealing with this on a day-to-day basis. So I know that's the guidance that you're getting from state DOH and your local health department, but just know that there's a high level of anxiety around, even 50%, as you can imagine.
Yes.
Thank you.
Thank you.
Okay, next up is Tracy. Hold on a second.
Mute.
Go for Tracy.
Yeah, I'm here. I just have to mute. Can you hear me?
I can hear you, Tracy. Thank you.
I have a couple of special ed questions, but I'll just call Ricardo Soto or send him an email because
Okay.
they're really specific to my child.
Yeah,
But I'm curious. You say substantive interaction with the students.
Yep.
And you said you had some ideas around that. I'd just be curious to know what some of those are.
Yeah, it's it's going to look a little bit different at the high school than it does at the elementary.
Yeah, mine are both in high school, so.
Yeah. So basically, part of it is going to be there will be a slightly shortened day to accommodate a distance learning period at the end of the day is what we're thinking. To accommodate the cohorts. But we're working that through with our Teachers Association, and we really don't have. Again, we had 2 weeks to put a plan together. We've been thinking about it, as I said, for a long time now, and we're in discussions with the Teachers Association because one of the things that we really want to see is consistency, right? We want to see the same kinds of things happening in all the classes. So there would be sort of like a certain expectation for what it should look like. And as we're defining that, what I can tell you is our teachers are 100% on board to say that yes, every kid needs to be engaged, in some way every day. The content needs to be delivered every day. And so we, the most common thing we saw, the most, the highest amount of feedback, something like 70%, 65 to 70% of parents said the most effective thing that they got was the video lessons the teachers did. And then second to that was the in-person. So, we're trying to use that feedback to have conversation about, well, what is it that's going to be most effective to connect kids in this hybrid model that we're proposing for now.
Right.
So
Well, I would just say that I know that everything had to be done in crisis mode. But between two kids, one was in middle school at the time, one in high school, only one teacher out of 16 literally did a YouTube every morning, YouTube lesson. Otherwise, my kids did not see their teachers. So I don't care if everybody stays home forever, as long as there is that substantive, true interaction where they actually see their teachers and it's not left to them to have to reach out to the teacher. There should be an availability where it's not optional, it's mandatory that they have to be online with their techer.
Thank you for that.
That's just my 2 cents.
No, I appreciate it.
I know how difficult this whole process is, so I don't want you to think that I'm being difficult.
I'm with you 100%, and that's our conversation. Our conversation is about making sure that we're putting those kids first and making sure that that contact is substantive. So know that that's our intention, and that's what we're working toward, and our teachers are supportive of that. So please know that.
Okay, thank you.
Yep.
Okay, up next is Christine.
Do I have to unmute myself?
Nope,
You're good.
Oh, hi. Thank you, Bill and Ron, for keeping us all connected today. My question is, I have 2 children who are very involved in band and also in the arts, and I'm just curious, how will band specifically, that's what my 2 children are involved in, how will that be? What's the plan for band?
Yeah, and that's a tough one, right? Because I'm learning all this new vocabulary. Some of the new vocabulary is that is considered a super spreading event, is what they refer to it as. So singing, blowing musical instruments, or aerobic activity requires 12 feet of social distancing now. So that's problematic, right? So, when possible, we could try to do band outside, but I need to leave that up to the music educators to say, and again, making sure that we're following the kinds of protocols that are essential. Wearing make obviously the social distancing, the ventilation, all those things are going to be critical. How they space the kids, where they put them, but full ensemble is going to be really difficult to do. We certainly don't want the kids to lose out on those kinds of opportunities and participate in those things that they're most passionate about. But I don't have a definite answer of what it's going to look like yet. We're working through that. We're intending to do what we can to support our kids that have a passion for band. But that's going to be something that we're going to be working together with our teachers to make, to do the best we can.
Thank you. There have been some articles that have been released in the last couple of days from the organization called NISMA, and they have had some studies, and, obviously you're going to follow the CDC guidelines, but they are trying to write to the state and to everyone just to say that they've had studies shown that it doesn't need to be 12 feet. It could be 6 feet. I mean, I just think that these kids, all these kids in music and art and chorus, like, it is so important to them. And if they don't have the opportunity to at least do this live, like, online is so hard. It was close to impossible. We pulled off the national anthem for 8th grade with a handful of children. And, it's just important, and it really needs to have a home. It has to happen, even if it's after school hours, because if there's no clubs, maybe they could do band. I don't know, but it needs to be, if possible, it really needs to happen. Thank you.
Yes. Thank you.
Okay. Next up is Megan.
Hi, how are you?
Hi, Megan.
Hi. I just had a question. You mentioned that students would be receiving their IEP services, OTPT and speech and things like that. If they're not in the 811 self-contained, is that going to be during their distance learning, or is that going to be when their cohort is live? And the same goes for AIS services.
It's, what, all of that, I think that's the kind of conversation I think you might want to have with Mr. Soto, because every student's individual circumstance is unique based on their IEP. So tough to answer in general terms, but when the students are in person, we're clearly going to be providing those kinds of services, as well as, whenever, whatever services need to be also be provided virtually and can be provided virtually. So it's going to be a mix, but certainly, in person is the best way to deliver those kinds of services.
Okay, and I guess I'll ask Mr. Soto too, because if it's like a group speech type thing, if confidentiality is going to be breached, if it's via Zoom, things like that. I know there's like a lot of red tape with all that kind of stuff. And I just had one more follow-up question too, just kind of like vague for working parents. Have you given any thought to people who have to work 5 days a week who are going to wind up using daycares? I know our goal here is to limit exposure, but I can't help but think that that's only going to try to make it a little worse.
Yeah, you know what? I mean, absolutely. We have thought about that. But, as I said, once, when I have to think about health and safety winning out in those decisions, that's kind of where we land. Ideally we're in a place where we can begin to open up, but I just can't say when that will be until we're comfortable with what we can safely provide for everyone.
Okay. Thank you. I appreciate it.
You got it.
Okay. Up next, they're just called iPhone.
Hi, sorry, it's Paul Hawkins. Can you hear me?
I can hear you.
Great. So two, I want to say quick questions, but probably not. So the first one is, you've spoken about the fluidity of the plan, and I guess the first question is, if a child or parents decide to do remote learning at the start of the school year and then want to change into the cohort A or B, is that a possibility?
You know what? Oh, it's a big conversation, right? So you're right. I don't know that that's a real quick answer. I would like to say yes. We would like to be able to provide that, because the students enrolled. So we just need to be able to ensure that whatever planning we've done, that doesn't interfere with the ability to socially distance and to things like that. But certainly, if they are in one cohort or they were scheduled to be in one cohort, it should not matter. I just don't want to give you a guarantee on that because I'm not exactly sure. We would have to potentially move things to make your child fit back in.
Totally understand. And then I guess the second question real quick is, we're relying on sort of the honor system with regards to temperature taking and things like that. And I'm wondering what the rationale is behind not having that sort of mandated or done at the school level, as opposed to, hoping that someone is actually, doing what other people are doing.
Well, the guidance that comes out, there's two pieces to it, right? There's a lot of layers, to be perfectly honest. First and foremost, the guidance suggests that the kids should be evaluated prior to coming to school, which means they would have to be on the bus or like we're doing in the car loop, right? And we will have thermometers that we could check. But the other problem is if we allow kids to come in and then we have this, who knows, hour long arrival procedure where kids are waiting socially distanced outside the school, then we potentially, have other concerns for safety that could arise. So what we're attempting to do is, partner with parents and make sure that, if they can do it, they can do it and hope that, this works for us. And again, like if this doesn't happen, well, then we're going to have to, rethink this and come back. And, this is part of that, we're at 50% capacity. We think we can manage this. If it's going really well and we can take temperatures of every kid, as they're coming through the car loop, that's a whole nother layer that we potentially would be able to put in.
All right, great. Thank you so much for all the work that you and all the staff have done, and we really do appreciate it.
Thank you. I appreciate that.
Okay, up next is Colleen.
Hi there. I just want to say thank you. I know it's a great undertaking trying to bring this all to the best case scenario in the worst case scenario. Just the September, you had those review dates of September 21st and October 13th. So my guess is that you come back together at that time and then there would be a revamp in the plan to possibly bring the kids back more times during the week, or because I know in my district, our review date isn't until October 30th. So I was pleasantly surprised to hear the September 21st and October 13th dates.
Well, I think September 21st gives us like 2 weeks of data. You know what I mean? Because what we're looking at is really understanding what our bus ridership looks like and what our cleaning sanitization on the buses, transportation's a linchpin in this plan. Really recognizing what it looks like in those individual, cleaning in between periods during the high school period, classes. What does the social distancing look like in our elementary classes? How many kids have opted now to stay on distance learning? Do we need to restructure what those classes look? There's a lot of factors that can play into this based on parent decisions and our capacity to implement the plan that we're putting in place here. So that's why I say it's really sort of a phasing in and a reevaluation, just constantly reevaluating. I mean, I could tell you that we're going to circle up on day one and say, well, what worked and what didn't,
Right.
Because that's what we're going to have to do to really make sure that everything we're doing is, keeping the health and safety of the kids at the forefront.
And when you said that, like about like how well it goes, my other question or thought was like I have a 7th grader and a 5th grader. So what are the chances that that's going to be looked at where both of my children are going on the same cohort days? So,
Yeah,
you know,
that's
one's at Clayton Huey, one's at the middle school.
Yeah, that's our intention. That households, so not just by name but by household, anyone in the same household would be going on the same day.
Okay.
All right.
And then with that, I'm sorry, I'm like just piggybacking. So the
Yeah.
attendance that's going to be taken daily then. So like if my children go say on cohort A, what would happen like on Wednesday, Thursday, and Friday? I know that they would be accountable for attendance, but is it at least checking in that day, or will they have to check in at a certain time? Because now childcare obviously would come into play with that.
Exactly, and that's part of the equity issue, is that we want to make sure that there is access to the lessons presented. The same content that is being delivered live in the classroom should be delivered to every child that's in a distance learning mode. Okay,
Right.
So that's where the attendance piece has to play in, that the kids there's some evidence that they either access the video or whatever, but the teacher needs to log the attendance.
Okay.
And that could be, at any time. Any evidence that the child attended school that day and what that looks like for that class.
Okay. And then my final question, just really like a readiness level assessment, just what does that look like? Is that just, yeah.
So we need baselines, right? We really need baselines. So typically, I'll use, for argument's sake, kindergarten screening. We did not do kindergarten screening last year. So
Right.
What do we have to do? We have to, when those kids come in the beginning of the school year, we're going to need to assess those children. And then we're going to need to figure out, what their readiness levels are to begin learning, and then form classes, because we haven't been able to do that. So we're now starting from scratch with that. Now, when we assume that kids, I'd like to assume that everything we did from March 16th through June 26th was as strong, as robust and supportive as any other year. But that may or may not be the case. There are some kids that may not have progressed as we would have liked them to progress. So they may be starting their 6th grade year, or their 5th grade year, or their 3rd grade year, or their 12th grade year, slightly behind where they otherwise would have. We need to take assessments and figure out where kids are academically. So that might be a reading benchmark and a math benchmark, so that we can say, all right, well, we have to pick up where they are, and we have to accelerate their learning.
Okay. And that would obviously just be for the teacher's assessment. That wouldn't probably not too much move their class placements as it sits right now, especially I'm thinking Clayton Huey kids. Okay. Thank you so much, Ms. Masera.
Yeah, just real formative to try to get the kids, supported. Yep.
Great. Thank you so much.
You're welcome. Thank you.
Okay, next up is Brady.
How you doing? I'm a student at Center Merchants High School. I just have a question as far as the cohorts. So let's say, are you going to offer every class that's being offered on both cohorts? Because let's say I want to take AP Calc, and then AP Chem is on B and AP Calc's on A. Then do I have to go to school both cohorts, or will it be every class is on
No, so Brady, the cohort is basically the kids that you're in school with. You're in school in whether it's calculus, whether it's physics. You're still in school 5 days a week for that class, but 2 days are in person and 3 days are distance learning.
So I could be going to school for Calc on Monday, Tuesday, then distance learning Monday. Then if only accounting is offered Thursday, Friday, then I could be going 5 days a week.
You are going 5 days a week. What happens is that calculus class, if let's say there's 25 kids in that class, 13 of the kids in that class are attending live on Monday, Tuesday, and 12 kids in that class are attending Thursday, Friday. But you're all being taught 5 days a week for that class.
Okay.
Got it?
Yeah.
So it'll become much clearer, as we unroll that. But yeah, we're planning on keeping the master. We want to make sure all of the course availabilities remain intact.
Okay.
Thanks, Brady.
Thank you.
Okay, one more. Jennifer.
Hi, how you doing? This is Rich Wagner.
Hi, I'm Jen. Thank you so much for all that you're doing right now. So for the elementary school, does that mean there's only 3 days of instruction a week?
No, it's 5 days of instruction a week. And again, we're still sorting through exactly what that model is going to look like. But we're talking with the teachers, and there's a connection to the teachers 5 days a week. But the in-person is just the 2 days a week.
So the teachers will be teaching a cohort, but also teaching virtually at the same time?
Right. So whatever content is being delivered in live instruction also will be available to the kids on distance learning.
Okay, so it's not like they'll be teaching a lesson Monday and Tuesday, and then reteaching the same lesson Thursday and Friday for the other cohort.
No, it's I would almost, like if you looked at it like Wednesday is almost like the start of the week, like, and you have, like that's a full distance learning day where everyone's on distance learning, and you're kind of like launching a week. And then you'd have, that would be like day one, and then day two would be Thursday, day three would be Friday, day four would be Monday, and day five would be Tuesday. That's how I would almost look at it.
Okay.
So it'll be 5 days of instruction, but 2 are live, 3 are distance.
Okay. Now, what is the district's suggestion on the parents who have to work 5 days a week, including the teachers within your district? What do we do with our children for 3 out of the 5 days a week?
I honestly, I don't have a good suggestion. And we thought about all that, some of the suggestions were around like half days, AM, PM days. And does that help? And that would be impossible to clean and sanitize in between cohorts. So, and we get cross contamination. So all of these other things, had, just worse possible, outcomes. So we kind of stuck with this. And at least there is consistency. You will know every single day that your child will be in school until such time that we reevaluate and, provide, more in-person opportunity. So it's not great. I get it. And it's not it certainly is not the most educationally sound. I'm not claiming that it is. But at the end of the day, first and foremost, I have to, try to ensure the health and safety of kids and teachers and staff. So unfortunately, this is where we're landing for now.
Thank you, Dr. Masera. This is Richard Wagner. I have a couple questions as well. Regarding the split A and B, is that specifically for Clayton Huey, but also for the rest of the district, is that grade level or is it per class?
That's per class. It's to reduce capacity in the individual classes.
Okay, so the students that were given their teachers, such as my 4th grade and 1st grade, they'll remain in those classes, and those classes will be split by a letter. And right. I'm assuming that they've been looked at to make sure that there's not front-loaded with a bunch of, last names that start with A and B, let's say. Right.
So, right now, what I'm saying is we want to maintain everything that was that was put in place. However, if we need to go out there and work with the parents. So Rich, you're going to be getting surveys from me. Survey's going to say, what is your intent for transportation? Is your intent to send your child to school? Is your intent to keep your child home on distance learning? And if we find that one class has, a particular grade level has, 25 kids that all want to be on distance learning, we may be in a position to say, we probably have to assign a distance learning teacher and reshuffle that a little bit. And I'm not saying that that's going to happen because we do not know what we're up against. So, I am going to ask for a little bit of patience until we really get all the good information that we need from the parent surveys that'll be coming out. But we'd like to say we're going to keep everything exactly as is, but I can't in good conscience give you a 100% guarantee of that.
Understand. And I'll make my last question quick because you just kind of touched on it. If a particular section were to have parents, let's say half of the parents decided to not send their children into school, so now you have 50% capacity in that section, would that section be available for full week, assuming minus Wednesday, in-school learning?
I mean, here's what I could tell you. Nothing's off the table. But we also, have to think about the equity issues, right? And so I want to make sure that whatever we do is fair and equitable, because, access is critically important, that all students have the same learning experiences. So it's going to be a challenge for us to try to work through all these issues. But what I keep telling the elementary teachers is we're not taking anything off the table. We want to have good ideas, but we want to provide consistency in the experience that all kids get in Clayton Huey.
Excellent. Thank you very much. I appreciate you taking our questions.
Oh, you got it, guys.
Okay, up next is Daniel. All right, Daniel, go. Okay. All right, moving on. Next, let's see, McGill. Mute.
Yes, hi.
Hello.
Hi, Ron. Thank you for tonight.
Hey,
two quick questions. Do you guys know yet how you're going to be determining your cohorts?
We're trying to do it so that the cohorts are organized by households. So
Okay.
it's really likely going to be an alpha.
Okay.
But, recognizing some families have, might have different names, of the children and all that. But clearly that makes the most sense by household, because, if a child gets sick in one household, that likely impacts, the rest of the family, could potentially impact the rest of the family, and thereby the cohort, should be in the same cohort.
Okay, sure. No, that makes sense. And just a question. We've talked about in-person learning, live learning, and remote learning. So I understand, on your in-person day, it's going to be live. Will it be live instruction on your virtual day? Some of the students had live classes during remote learning in the spring. So will those students, especially my concern at the high school, students who are remote learning from home, can they access the class that's being taught to the other cohort via some live method, Zoom, Skype, something like that?
Yeah, that's, and again, that's one of the things that, we're working out with the Teachers Association for what the expectations are for that. So I can't guarantee that there's going to be live instruction. I can guarantee that there will be access to, instruction 5 days a week at the high school. And what that looks like, there will be much more consistency in terms of what's provided, as compared to the spring, when we were kind of, inventing it as we kind of went along. So that's something that I've been talking with the Teachers Association, and I can't thank them enough, because they're just 100% open to the conversation, and really understand that there needs to be a lot of consistency in the types of instruction that's being provided.
And then will there be a way for high school parents to know in advance what each of their children's courses would look like? Because I know it's, very specific to each teacher how they choose to deliver the instruction. But for children who, where the parents are considering placing them in what they would consider, a more challenging course, where they think their child would be more successful with, instruction delivered live 4 or 5 days versus, some other method, will we know in advance what type of learning our child's class will be like? At the college level, the kids signed up for class. They know if it's in person, if it's hybrid, if it's asynchronous. Will we know that when we receive their schedule home so that we can make adjustments if we don't think they're going to be successful in the format that class is going to be delivered?
Yeah, I mean, I'd love to say yes to that, Heather, but the honest answer is I can't make any promises to that, because we're not even sure how we might be adjusting what we're doing. Like, because our plan is supposed to go from, in person to hybrid to distance learning and back, flexibly. That's what we're expected to be able to provide. So, to whatever extent possible, the ideal is that we move toward 100% in person. Can we do that? That's going to be a matter of, what the metrics look like and what happens with regard to, things like possibility of a vaccine or something. You know what I mean? Like, there's so many things that we don't have control over.
No, I understand that. I'm just saying, if you have a teacher who is committed to offering live instruction, so either in person or remote, but live, the class will be live, whether you're sitting in the classroom or you're doing it remotely. If we know that in advance, we may be more comfortable saying, yes, go take that AP chemistry class or something, because we know there's going to be a live component, for 4 days a week, as opposed to, 2 days live. If we know certain people are committed, it makes that decision easier. Whereas I think a lot of parents have been discussing removing their children from honors classes, advanced courses, because they're concerned about the rigor without as much instruction. It would allay some fears if we know in advance that certain classes are committed to delivering instruction one way versus another.
Yeah, I mean, the only thing I can tell you is that what I'm trying to, work with, and like I said, with the Teachers Association, is that we're going to get some kind of a model that's going to be consistent, so that all will be doing something very similar.
So there could very well be where there would be no live classes on virtual learning days if it's like an all or nothing kind of proposition.
Well,
I'm just trying to understand.
Yeah, no, I know. But again, we're, and I'm sorry to, like, if I sound like I'm hedging, but I don't want to make promises that I can't.
I know, and I completely understand that, and it's a really difficult situation. So I totally appreciate that as well, just to the extent that it's something that can be explored, before you start the school year and guidance gets flooded in week 1 of, I want my child out of the honors class, I want my child out of the advanced placement class, and you have cohorts already divided based on your classes, and now you have a slew of parents asking for changes to their course schedule in that first week because they don't think their children, will be successful, under the model they're going to be provided. To the extent that we have that information in advance, I think would save a lot of headache possibly on the other end.
I gotcha. Understand. And that's, honestly, it's great feedback for us to consider, and how we might be able to handle that. So I certainly appreciate that. And I will, I'll kind of take that under advisement and try to work out a solution for you on that.
I appreciate it. Thank you so much.
Thank you, Heather.
Okay, up next is Jeff.
Hi, Dr. Masera.
Hi.
Thank you for everything you're doing right now. I know the absolute nightmare of all this is we're living it in my district and in the jobs that I do in the summertime as well. My first question is, I have an incoming kindergartner and a third grader at Clayton Huey. And, having lived distance learning as a teacher myself, I know how much of a nightmare it was as an educator. I can't imagine what it is for parents, but I'd really encourage in those lower grades that with the distance learning component, that not be something that's tied to a time for parents. Because some of us, I'm an essential employee and so is my wife. Our kids aren't going to learn until nighttime when we get home. And to really make them required to be live during the day at wherever we end up finding daycare for them, it's not feasible and not reality.
Yeah, and that's again, that's the equity issue, and you know, it looks different in every household, and we recognize that. So I appreciate that.
Okay, and the second thing, and I'm going to speak for your teachers because I know it's a nightmare as a teacher, but every district has a different response to this. Our district is an elementary school, and we're going to be potting with everybody in the building. Do you have plans and considerations for your staff members who are in the same boat that we're in, where you have two kids that can't care for themselves, that there's nobody home to take care of them? Are you going to be accommodating your staff members for that?
Trying to help our staff members, you mean?
Correct.
And support them, yeah, to whatever extent possible. You know, we will. You know, I don't know what accommodations we can put in place, but if we can, we certainly will be doing whatever we can to support our staff.
Because the reality in the real world right now is everybody's saying it's not my job.
I know.
You know, the banks are saying it, the hospitals are saying it. You know, it's somebody else's job to take care of your kids, and it's not the reality. And it was okay for, you know, first responders in the beginning, but now that everybody's in that mix, you know, there needs to be an equity component to that. And I feel like, you know, your staff really can't advocate for themselves on that, so we should be doing that as a community for them.
I appreciate that. Thank you,
Thank
Jeff.
you.
Okay, up next, let's see, unmute. I have owner's iPhone 2.
Can you hear me?
Yes, we can hear you.
Okay, this is Emily. I'm going to go with this. This is my phone. So I know it's, well, let me start with saying we are a household of 2 teachers with children in 2 different school districts, sort of. One is in BOCES. So we're dealing with 4 reopening plans. So it is such a relief to get this information and hear all of what you have presented tonight. So I thank you for all of the time that's been put in by so many people in regards to this. I am left with a question, and it's very, very likely you don't have an answer, but I think it's important that I ask. You know, because of our circumstances, for us, 100% distance learning is our only option. What does a day look like for my daughter? Just in general terms, like, and you're likely still talking about this. So, but you know, in my mind, like, does she have, you know, would my daughter have teachers that are, you know, focusing on distance learning kids that are fully distance learning, or is she a part of, are you seeing them as a part of the roster within the model that you presented tonight? You know, what does a day look like? Like, you know, that other parent mentioned about, you know, being signed on all day. You know, we're all going to be home, and we're going to be, you know, doing distance learning with a child who is unable to do any of it independently. So she, you know, has one of us as her facilitator, also working at the same time. So, you know, I don't know what's good for us, but I'm just curious, like, what does that look like? Is my kid going to be on all day? And again, it's very specific. So, you know, it could be something that is just a specific circumstance that is, you know, I don't know.
Yeah, you know what?
Sorry, I'm all over the place.
No. I totally understand it. I totally get it. And, you know, when I talk about a model being fluid, it really has to be, because we build this thing, and now we're going to go out. We have a plan, right? But we're going to go out, and now we're going to go out and collect data, and we're going to ask all parents, and we're going to have to do lots of outreach, because we're going to kick out these surveys to try to find out what the intention of parents are, and then really examine that data to see what that looks like, and that might impact our plan, might impact, again, what that, you know, whether there's a dedicated distance learning teacher, or there's a, you know, because we're also going to have staff members that are going to tell us, you know, I have to take a leave of absence, or I need accommodations for a leave of absence, whatever that might be. And so we may have teachers who need to teach remotely, and they may in fact be distance learning teachers. And I don't know who those people are. I don't know which children are intending to come to school. Once we have all of that information, I think we can, again, reassess, and we're going to be doing that in the next week. So there's a lot to this. There's a lot of moving parts. There's changing guidance almost, at least weekly, if not daily sometimes. So all of those factors coming in, I can't give you a clear definition of what it's going to look like, but that will be coming, in short order. I hope that helps, but.
Okay, up next, let's see. I have Renee's iPhone.
Hi, this is Renee Masera. I have an elementary school and a high school student. So my elementary school, I don't know how the breakdown is going to be with, A through Z. And I also don't know how it's going to be with my child who needs additional assistance. So I get that there's going to be a breakdown with letters. I also know that she's in accelerated classes. So I understand there's going to be a breakdown with letters. How is additional support going to be provided? I also understand there's going to be a breakdown with the AB classes, with the breakdown with a day off. How are we going to support children who need additional assistance, IEPs? How is that going to be supported, and what do I need to do to make sure that's assisted with children who need that and children who have AP classes, and what do I need to do to make sure that's assisted?
Yeah. Honestly, in terms of the IEPs, it's so specific to the individual children that it's hard for me to answer in general terms. But what I can tell you is some services can be, delivered virtually. Some need to be in person. And so what I would suggest is in terms of that, I would have, you can contact Mr. Soto on an individual basis with regard to that, and talk through your child's individual case. But then in terms of the AP or accelerated classes, we're functioning, with our teachers are going to be teaching those classes. And it's just going to be a little bit of a different format, because some of it's going to be in person, some of it's going to be virtual, but the course will run and it will be delivered by a qualified teacher that can make that happen.
Okay. And the IEP is new to the COVID issue. So this is something we're pursuing new to the challenge with the COVID. Right. So, I think this is new to something that we're dealing with regard to that. So, I'm new to the whole process. So
Gotcha, okay.
I also know that I think I'm challenged with the A to Z, how many kids are going to be broken down.
Right.
We're looking at 15 kids to class. So I'm also thinking about how many kids in my elementary school. We're breaking it down, my kids in elementary school. So how are we going to break this down to somebody because I also have a son who's going to be in elementary school. What if A to Z doesn't break down to A to M? How are we going to break that down for him?
Yeah, no, we've already started to look at that. And it's going to be a district wide, because we want to separate out the houses to cohorts. So that information will be coming out. But I don't have it for you, at the moment.
Okay. I have the luxury of being able to work from home until this is done. I can support it.
Gotcha. Okay.
I guess I'm worried about anybody else who can't, I guess. So I guess it's a concern for me overall for my kids, but anybody else who doesn't have that ability. So I guess overall, but thank you for addressing it.
No, thank you.
Okay, another one. Up next is Carlene. Carlene Elio. Can you hear us, Carlene? Okay, moving on. Gina H.
Hi, thank you for taking my question.
Hi, Gina.
Hi, I hope that I'm not repeating a question.
That's okay.
Because I did have a bad connection here and there. BOCES. Did you touch on that at all?
I have not.
Do you have any information on how that would be handled?
In terms of a child that attends BOCES?
Yes.
Okay, so that basically, we would not be altering that. That they're going to have their own, reopening plan. Is your child a 12-month? Because if they are, they are running summer programs right now, and so that program would run, and your child would be transported to the program. So
He's in well, he's going to be going into his senior year this September,
Okay.
and he's in a 2-year BOCES program. So he just completed the first year.
Oh, I got you. Okay.
Yeah, and I'm hoping he,
So
is.
an ACAD program, like half day?
Yes, yes.
Okay. Yeah. No, my understanding is it's still running. I could double check on that, and we can verify. But I do believe the occupational education programs through BOCES are running.
So if they're going to be running 5 days a week, is he going to be able to go 5 days a week, or
I
we
tell
don't
you
know that yet?
This is a very specific question that.
Okay.
Why don't you, if you shoot me an email to rmasera@cmschools.org, rmasera@cmschools.org with the specifics. I can dig into that for you and get you a good answer.
Okay.
In a matter of no
Sounds good.
time. Yeah.
Okay, great. Thank you so much.
Sure, no problem.
Okay. Thank you.
Okay, up next, Joanne.
Hi. I was wondering if you had given any thought to students receiving grades this year, specifically in the middle school and the high school level.
Yeah, honestly, last year, kind of the COVID pandemic came as a shock and a surprise to us. And so we really wanted to have like sort of a do no harm policy. And we really didn't want kids to be impacted that were, negatively impacted, whether it was, socially, emotionally. But, we are intending to move forward with, a standard grading practices. But, keeping in mind, we will be looking closely at it so that it's not something that, it's very clear from the start,
Okay, thank you.
The expectation will be clear to kids and for teachers and everybody.
Okay, thank you.
Okay, one more. Let's see if we can unmute. Daniel Bauman. Daniel, you there? No. All right. I got another one. Let's see. Jack. Hello, Jack.
Yes, hello. Can you hear me? My name is Gabrielle. How are you?
Okay.
Hi, Gabrielle.
Okay. I just wanted to say thank you again for what you're doing, and your visibility is keeping the bucket full in our community. And just a quick shout out to Mrs. DeFries, who was absolutely magical and just kept her entire class set of parents absolutely sane and grateful for what she was able to translate in the classroom with her children. And having survived that and had witnessed what she was capable of doing, did you ever consider changing the schedule of the day to maybe have the teacher who was in the building teach for half the day live to the kids that were present in the classroom, and then that cohort of children after lunch would enjoy all their specials, and then the teacher would switch gears and go and do the distance learning model live with the kids at home?
what I could tell you is, you know, and I was speaking to actually Mr. Freeze yesterday, and Ms. Valentine and Ms. Volo, and my conversation with them is I wouldn't take anything off the table. What I'm interested in making sure that every kid in Clayton Huey and in our middle school and our high school gets a robust curriculum, an entire year's curriculum aligned to the next gen standards. And, you know, that's what we've got to do. And if it was, you know, if a creative solution like that is something that can work for us, I am 100% behind it. So that's the work we're in right now, is coming up with a model, and again, but a model that's consistent, you know, across our, you know, our elementary school, our middle school, and our high school.
Thank you.
I thank you for that. Good thinking.
Okay, we'll try one more time here for Daniel. Go ahead, Daniel.
Well,
Okay.
you know, Bill, I think, you know, we're getting at almost the 2-hour point now. And so what I would say is, you know, again, you know, anybody can reach out anytime. I'm happy to take questions in the office. What I will do, since we maxed out today, we'll make this 2-hour video available tomorrow morning. And then I will, you know, open up the lines tomorrow evening. I'll pick a time that looks good, probably around the 7 o'clock hour. And we will do this again tomorrow, so people have a little time to think of, you know, what are the questions they might have and want to ask live. You know, so if that works, I just want to take this opportunity. You know, I think we've got just a remarkable community, and I want to thank everybody for coming out tonight. We had 300 people on this call. We still have about 200. That means we've got a really engaged group and people that really want to be informed, want to know what's going on. So I would just ask that you spread the word, let people know what we're planning. We will post this presentation, as I said, in the slides presentation will be up tomorrow, as well as the video. And then we'll have another Q&A tomorrow. All right. So thank you all for coming. And I really do appreciate it. And I appreciate the questions, and you sticking with us. So, you know, think about that hashtag CM positivity, and let's keep that rolling, because we're going to need it as, you know, to get through this year. So once again, thank you all for being here tonight.